Patrick, thank you for that. Now, it's been less than 24 hours since the president's COVID diagnosis. We know the next few days are critical. So joining our coverage, we've asked Nurse Alice to help us out again. Nurse Alice, Robert and I were wondering about this. Does it appear his symptoms are progressing quickly? We heard last night he had tested, and then this morning we wake up, he's got a low-grade fever, and this afternoon he's in the hospital. Is that quick?
Well, actually, it's expected. So what we know is once someone has been infected, they can start to present with symptoms anywhere from 2 to 14 days. So you can look back 2 days and see when he might have been exposed. But once this is the beginning of his symptoms. So I anticipate that these symptoms may get worse as time goes along. Shortness of breath, fatigue, low-grade fever. These are things that often present with COVID-19, but can get worse, especially with someone his age and his risk factors, having obesity, high cholesterol and other things.
The White House indicating that the president is continuing to work over the next few days. Nurse Alice, is that advisable or should he be resting right now?
I would advise the president to rest. He needs to focus on getting well. The president is under a lot of stress with things going on in the news and an upcoming election, but those things can actually weaken the immune system, and that's the last thing that he needs right now. He needs to put all of his energy into getting better, taking the medication, getting rest, so his body can recuperate. Adding that extra stress by still working is just going to take away from the healing process.
Nurse Alice, we want to bring in a photo right now. If we put it up on the screen here, this is from September 14th. It shows Donald Trump and Hope Hicks on the left here, seated across from the president. The president inside Marine One as it lands on the south lawn of the White House. As you can see, she is wearing a mask here. He is not. And so the question is, while it's important to note this is a couple of weeks ago, we don't know who, how, or when the president was infected. We do know that she's tested positive and showed some symptoms, but it brings up the conversation about face masks. One person wearing it, the other person is not. What's your advice on this?
Just like two heads are better than one, two masks are better than one. Masks are extremely important at delaying the spread of COVID-19. Wearing that mask prevents the droplets from spreading to others. So masks are really important to protecting others. Now, if one person was wearing the mask and the other is not, you can still become infected. And we know that this is very important. Not wearing a mask will increase the spread. And I think also in that picture, you can see that they're in a closed space with limited fresh air, and there was some talking going on. So there was some droplets spreading. They looked closer than 6 feet. So all of those things together play a role in whether transmission occurred, whether it's in that particular scenario or something similar. But we've seen the president move like this. So having this type of behavior definitely was what put him at risk, and now it does have COVID-19.
And Nurse Alice, just quickly here, we have a list of people right now that we are ticking off who have tested negative, including the vice president and including former Vice President Biden. Are they in the clear?
They are not in the clear just yet. When you've come in contact with someone who's tested positive for COVID-19 or had symptoms, we ask you to quarantine for at least 14 days because symptoms can take anywhere from 2 to 14 days to present themselves. So Biden needs to make sure that he is, and others, quarantine for at least 14 days to make sure that they don't develop the symptoms and also that they don't spread the virus while they may be asymptomatic. So 14 days quarantine is definitely a must for Biden and others who've been around the president.
Very interesting. Nurse Alice, once again, thank you for your insight.
Thank you.
We are going to step back outside. This is a live look.